Heart disease in India is on the rise. Take one look at the cardiology department of any major hospital and the numbers will speak for themselves. But what if one were to find out that all the people you see here are in fact the lucky ones? That there are many others who never even made it this far. Their hearts, without any sign or warning, just stopped beating. In seconds, they were unconscious. Within minutes, dead. Victims of a condition known as sudden cardiac arrest.
The main causes that cause sudden death are the heart. Because heart is a pump which supplies blood to all parts of the body. So if this pump stops for a short while, maybe 3 minutes, that's all that is needed for a person to die. So the heart stops for 3 minutes and you're gone. So basically all these things stem from the heart. And it was a misnomer or a myth. People thought that people who died suddenly had a heart attack. It is not the heart attack which causes sudden death. It is some kind of a arrhythmia or irregular beating which actually causes the heart to stop.
Dr Balbir Singh is one of India's leading cardiologists and electrophysiologists. He is an expert on sudden cardiac arrest.
There was a study done in Europe and America in people who had died suddenly. They looked at their hearts and found that only very few people actually had a heart attack as the cause of sudden death. So heart attack actually causes chest pain, sweating, and the patient gives you time. And then he may die fast, but he has given you something that he had chest pain, he had sweating, breathlessness, and then dies. Sudden death is an arrhythmic death, where a person was sitting fine, hale and hearty, and then he just collapses. Or he may have been sleeping well, and night he said good night to everybody, and in the morning he's no more. So this is what are arrhythmias or irregular beats which can do to the heart.
Our lives are becoming increasingly stressful, our cities more congested, our diets and habits are not as healthy as they once were. It's no wonder that heart disease is on the rise, and sudden cardiac arrest accounts for over 40% of all cardiovascular deaths in India. A scary thought when you realize that they can strike anywhere, at any time, and the victim never knows what's coming.
So once we realize that sudden death happens so fast that it's difficult to save a patient. You know, if somebody has a problem at home, no doctor will or no equipment can reach him in time to save his life. So we must identify people who could potentially have a sudden death. And we have some predictors. We can predict that this person is at a higher chance of a sudden death. The biggest predictor is anybody who's had a past heart attack, and what we call as the pumping efficiency of the heart. We calculate by the ejection fraction. If it is less than 35%, we consider such patients to be high-risk patients. In India, heart attacks come much earlier in age than the Western population. So it is clear that the previous heart attack or the pumping efficiency could be at a younger age, and the younger could be prone to sudden death as much as an older one.
With so many people at risk, there is a critical need to prevent a sudden cardiac arrest, and that's where an ICD comes in.
Basically, ICDs are defibrillators, which are called implantable cardioverter defibrillators. So they are implanted in the body, under the skin, just below the clavicle bone, and they're connected to the heart.
A guide wire is inserted through a small puncture made on the patient's left shoulder, and it is guided through the nervous system to the superior vena cava, the vein that carries the body's impure blood to the heart. A sheath is then slid over the guiding wire, which is then removed. A lead is now sent through the sheath. This lead is then connected to the defibrillator.
What we have failed in our attempts is to revive a patient at home who dies suddenly, or in the public systems, we can't help a patient who's going to die suddenly. But these defibrillators act like a doctor with the patient. It classifies each and every beat 24 hours a day, 7 days a week, 365 days a year. Every day, every minute, each beat is being analyzed by the computer. Now, once the computer gets to understand that this is an abnormal rhythm, this is likely to cause sudden death, it acts. It doesn't sit, it doesn't warn, it just acts. It acts by doing two things. Either it paces, that means it gives more electrical impulses to stop this abnormal beating, or it gives a shock to prevent it. So it is a perfect measure against sudden death. So from a person who's had a heart disease, this is a sure thing which can prevent a sudden death.
At the age of 33, Sohail Shah is at the prime of his life. He's a successful banker and father to a 2-year-old son. Sohail had never had any serious problems with his health or his heart. But one day, everything changed for him.
It started in the month of April 2010. For a couple of days, I had pain in my chest along with dizziness and had feeling of palpitations along with shortness of breath. So I visited my physician and was then referred to Vedanta Medicity. I was told to meet Dr Balbir Singh, who is a renowned cardiac electrophysiologist. Dr Balbir Singh then had to conduct an electrophysiological study to know or to see whether I can have an ICD implanted.
Sohail is presented to us with recurrent episodes of fast heart beating, and this rhythm was diagnosed as ventricular tachycardia.
Dr. Balbir's tests revealed that Sohail's heart was a ticking time bomb and advised Sohail to get an ICD implanted immediately.
The word ICD was quite new to me. I was then informed that it is an implantable cardioverter defibrillator, which is a device which monitors the heartbeat and delivers an electrical shock if the heartbeat tends to go up. On hearing the word shock, I was not very comfortable and in fact more reluctant to get this device implanted. But knowing the advantages of getting this device implanted in the body, I finally agreed to get the ICD implanted. As I knew that once the ICD has been implanted, I will be in safe hands, at least as far as my heart rhythm is concerned, because that was the main concern.
The procedure to install Sohail's ICD went off smoothly, but soon a new problem arose. Sohail's body was having an adverse reaction to the different medicines he was taking for his rare combination of conditions, putting his life in very serious danger.
After my ICD was implanted, I was put on medications to control my heartbeat. On the other hand, I was already on medications or on steroids to treat sarcoidosis. Now, once I started taking both these medicines together, the body did not seem to adapt properly, and due to this, I almost received more than 75 to 80 shocks. So in a way you can say that due to the ICD, my life was saved 80 times, which you can say that due to ICD or due to ICD implantation, my life was saved almost 80 times, because in every case the heartbeat went up to 200 beats per minute, which is life-threatening, and could prove to be fatal.
And one particular day, he received almost 20 shocks to save his life. And we implanted a defibrillator on him and did certain procedures to stop this ventricular tachycardia, gave him medications. He's perfectly fine. His life has definitely been saved, and so have been many others using these defibrillators.
Fortunately, I was under the treatment or under the guidance of a good doctor, a good hospital, and a device which will save you at each and every point of life relating to your heart, and also knowing that there is somebody to take care of you. And it is due to this treatment which I have undergone that I can play with my son now as like before.
what is sudden cardiac arrest? There are all sorts of diseases. Some that make you weak, some that cripple you. But sudden cardiac arrest is not one of those. With this disease, by the time you realize what's going on, you're almost as good as dead. It's a heart disease that is responsible for over 60% of all cardiac deaths globally. Sudden cardiac arrest is often confused with a heart attack, but it is related to the electrical system of the heart, which transmits signals to ensure that the heart beats in a regular manner. When this system is disrupted, one of two things can usually occur: tachycardia, where the heart rate becomes very high, or arrhythmia, where the heart rate becomes irregular. If this situation is left unchecked, a sudden cardiac arrest occurs, causing death in almost 90% of its victims. But studies have shown that if early defibrillation is provided within the first minute, there is a 90% chance of the victim's life being saved. And with each passing minute, the victim's chances of survival fall by 10%. That's not nearly enough time for help to arrive, and the victim usually faints and never wakes up again. An ICD, or an implantable cardioverter defibrillator, is a small battery-powered device that can be installed in people who are at the greatest risk of a sudden cardiac arrest. It constantly monitors every single heartbeat, and if it detects a dangerous heart rhythm, it automatically delivers a shock, restoring the heartbeat and averting a sudden death. In case a person is struck by a sudden cardiac arrest, CPR must be administered as soon as possible. If it is delayed for more than 5 minutes, chances are the patient will die. The patient must then be rushed to the nearest cardiac emergency. We've heard about the disease. We've heard what the doctors have to say, and we've heard the stories of the patients. But what's really on the minds of the people out there? We take our cameras onto the streets and find out what people want to know about this disease.
I'd like to know what goes wrong when a person suddenly suffers a cardiac arrest.
So it has been investigated recently that what happens to these patients who die suddenly. We have information on patients who died in the hospital, or patients who had some ECG kind of monitoring on while they died. So the commonest cause for sudden death is an arrhythmic death. That means the heart misfires. It starts beating very rapidly, and the heart cannot sustain blood pressure to the vital organs, so the person collapses. So this is the commonest cause. The heart is the key in most of the sudden deaths that happen.
So my question is, how is technology playing a part in saving the lives of people who are at the risk of sudden cardiac arrest?
Now we have important gadgets, including a defibrillator, which is like a pacemaker, which is in the body. So I tell my patients that, look, it's like a doctor with you. When your heart misfires, it is going to take up the action on itself. It is going to recognize it, that the heart is misfiring, and then treat it through various different modalities that it does. It can work as a pacemaker and stop it. It can deliver a shock to stop it. So there are many ways that this device can work and prevent a sudden death. Now the guarantee of this, looking at diagnosing a misfire and then treating it, is like 99.9%. So it's so accurate in treating these disorders. So now these devices are being used more and more often in patients who are high risk for sudden death. That means those who have low pumping of the heart, who have heart failure symptoms. These devices are being very useful and widely used over the world. So a device is about a rectangular structure which fits very well under the skin. It's very thin. It has a computer chip inside it which analyzes each and every beat of the heart, and it varies depending on what device we use. It varies from weights up to 36 grams to 75 grams. So it's very small. In fact, technology is improving so fast that we're going to get devices which are going to be penny shaped and very, very small.
Can you tell me how long is the